Hi, my name is Colleen Elias. I'm the practice transformation coach for outpatient practices, and I work with integrated care management. And this is my story about what brought me to healthcare. My moral compass is ultimately what brought me to healthcare. That might sound a little silly, but let me explain the nautical reference. After high school, I didn't know what I wanted to be when I grew up. I felt kind of lost, so I joined the military and spent 5 amazing years in the U.S. Coast Guard, where I grew enough to understand what I wanted out of life and my career. Important values were instilled in me that helped shape who I am today. And certainly led to my decision to choose a career in healthcare. The Coast Guard actually has a lot in common with healthcare. Its primary mission that we all think of is to save lives. That is precisely why I joined the Coast Guard, and it's sort of why I joined healthcare. You see, I quickly realized that the Coast Guard does much more than save the lives of people that are in distress at sea when I got assigned to my first duty station after boot camp. It was a 225-foot seagoing buoy tender based in Newport, Rhode Island, called the Coast Guard Cutter Willow. My initial thought was, really? I joined the Coast Guard to save buoys? Fortunately, it didn't take me long to understand that although our ship's primary mission was not directly involved in saving lives, the work that we did absolutely did save the lives of people by providing sailors with aids to navigation to prevent disaster from occurring at sea in our ports, canals, and rivers. It's really interesting to me now to see the parallels of this example and that of all of the different but incredibly important roles in healthcare. We may not all directly save lives, and just like the Coast Guard, that is not the only mission of healthcare, but we do all play a vital role in the delivery of healthcare. And none of us could do what we do without the support of one another. So that's essentially what lured me to healthcare, having the desire and the need to be a part of something much bigger and more important than myself, and to make a difference in the lives of others. I had the honor of doing that while serving in the military, and I have the honor of doing that now in my administrative role in this dynamic industry. That's how my moral compass led me to healthcare, and that's why I'm here.
When I was 5 years old, my father passed away from a heart attack. I feel that if they'd known more about preventive health care back then, they would have taken care of his hypertension and maybe, help with the not smoking. He was a smoker also. It's been 37 years today that I lost my dad. So that was my biggest reason for getting into the healthcare field. Also, my brother Steve is a health teacher, and he used to send me all kinds of books and things from college. So I would read through all those and kind of made it interesting how the body worked and all of that. And I ended up having him for his first year teaching when I was in middle school, so that was kind of fun. And his wife Heidi is a nurse at the hospital. She's been there for at least, I think she's close to 20 years now too. And she received the Heroes Award last year for her nursing career. But they're the biggest influences and why I wanted to get into healthcare. And I just really enjoy helping people. Is my biggest reason.
I've always loved learning. I've always loved working with children. Pediatrics seemed to me the perfect way to merge the two and get to always be learning and working with children and their families.
Perfect. And I'm gonna throw one more at you just because I just thought of this. Talk about just how rewarding is it on a day-to-day basis, working with these kids, helping them get better. Just talk about that part.
Oh, helping them get better, helping them stay better. Watching, I've been doing this for close to 25 years now. I still remember the very first year I sent kids off to kindergarten that had always seen me as their doctor, and that was just really rewarding to see them, go from cute little fuzzy infants to heading off to kindergarten and starting their school career.
I began my career about 6 years ago in healthcare as a medical assistant in internal medicine and primary care. And I wanted to add to the trust of patients and their personal healthcare needs.
Well, I had a bit of a circuitous route. When I was 2, I was diagnosed with bone cancer, and my family and I, due to a lack of resources actually in the Lewiston Auburn community at the time, we were sent to Boston Children's, where they were quite ahead of their time. Had a very highly integrated, multidisciplinary healthcare team. And so very early in my life, my family and I appreciated the value of multiple players on a healthcare team and how it takes a village to cure a child of cancer. So I had a psychologist on my team, we had a social worker, physicians, therapists, nurses. And I always felt as I was growing up that the healthcare system in Maine had a really strong emphasis on the medical aspects and a little bit less so on the psychosocial aspects. So I thought maybe that was where I could make a difference and come back to Maine and teach physicians about the value of psychology and social aspects of illness, and also do the work myself. So I received a PhD in health psychology and then came back to CMMC now about 25 years ago to teach medical residents and students about the value of taking patients and their families in the context in which they live and the challenges that illness brings into a family. So I've been pretty blessed, and I have loved being here and loved doing the work, and I have no intention of quitting now.
Well, I've been in the healthcare field for about 25 years, and I think what's been intriguing for me with healthcare is, as you know, data analytics and programming and things like that, they tend to be very technical. And I think bringing healthcare into that has made me feel like I contribute to society in a very positive way by helping patients and people within the community.
So I was fortunate enough growing up to be raised in a family that was supportive of healthcare. We also had the means to afford healthcare. My father was a physician, and ultimately, anytime we'd be out in the community, no matter whether we were at a sporting event, a cultural event, people would seek him out, wanting to thank him for the work that he had been able to offer for them or for their loved ones. And so early on, that really spoke to my kind of sense of a humanistic goal or a community approach to care and to medicine. And so ultimately, when I started looking into medicine, I knew I wanted to go into family medicine because it'd give me the opportunity to work with the widest spectrum of folks and contribute the most to my community. I spent some time after graduating undergrad working as a farmer and a carpenter because those were interests of mine, and that was where my first exposure to folks who really have no sense of healthcare. And so that was also important to see both sides of the spectrum. I'd been raised in a family very supportive of it. Any broken bone, it would be addressed. And then going to work with a patient population who had no access to healthcare and was too concerned with either the emergency bill or the urgent care bill to pursue healthcare. So it was the combination of those two events, and then fortunately I landed at Central Maine Medical Center's family medicine residency. It was a great program for me, and then I enjoyed the community so much that I decided to stay on for my fellowship. For me, primary care and healthcare is really about health. It's less about disease and treating various illnesses. So it's an opportunity for me to be centrally involved with preventative care and moving the health of the community forward.
I originally didn't know what I wanted to do when I got out of high school, and then so I tried a bunch of different things. Ended up having a car accident in 2000 that was really bad. Spent 11 days in the hospital at CMMC and decided that the nursing profession was for me. So when I recovered, I went back to school for nursing and did that for several years. Worked with nurse practitioners and decided that I wanted to pursue that as well. So I've done that. I feel like we teach our patients, but I also feel like I've learned so much from my patients.
A long time ago, I had worked in a nursing home, started out in healthcare. I really didn't know what it was about, but I started working in a nursing home taking care of patients who were very sick, didn't have a lot of family, things like that. And I ended up realizing along the way, taking care of some of the patients that I had, I ended up becoming close and just caring about them. I mean, during the holidays, family wouldn't come or anything like that, and they'd be so sad. It was just really heartbreaking, and I would feel awful and just go in and spend time with them specifically, and you know, it made their day, and they enjoyed it very, very much. Just things like that, that just, you know, having the compassion and caring about people really meant a lot to me, and seeing these people just so sad and have nothing, and I had all the things that they could want, you know, just someone to talk to care about them, to hug them, just to listen to how their day is, things like that. And that made like the biggest difference in their life, and just their overall general well-being just improved, and they became happy, and you know, they had a better outlook on life and not just sit in their rooms and be sad and depressed. And it affected me a lot, and it just made me who I am today and what I do.
I struggle to remember what actually got me into healthcare-ish work in the first place, because I started as a lifeguard, that sort of avenue, and then got into sports medicine, and I really don't remember what made me want to be an athletic trainer other than I knew I needed a college degree. I liked sports, and that seemed to fit. So I started there, but really as I kind of started the journey as an athletic trainer, I found that watching how we help the athletes navigate the healthcare system, I started to notice that there was a lot of waste, a lot of overuse of the healthcare system, things like ordering MRIs because we had to versus really not knowing what was going on. You know, we would have 3 professionals in the room who could tell us really clearly what was going on with that athlete, but we would still have to put them through an expensive battery of tests to just prove to the insurance company that we needed to take the next step. And so as I worked through sports medicine, I started, like I said, to see a lot of that waste and really get frustrated by that waste. There were several examples of athletes that I worked with that either were denied care or had struggled to get care, especially being out of state, because we didn't follow certain processes that were wasteful. So that really inspired me to kind of get more into the healthcare administration and start looking at how can we do this better for the system, for the patients, lowering cost, reducing unnecessary utilization, so that we really build a more sustainable healthcare system.
So I've been an LPN for 25 years. When I first got out of high school, I really had no idea what I wanted to do, so I didn't go to college. I just kind of fumbled around different jobs. I started at Western Maine Outpatient Center in Freiburg, which was my first experience in a medical situation. I was the secretary out front, and all the clinical and all the cool stuff kind of happened out back, and I was always, you know, kind of looking, what's going on out there, you know? I really enjoyed working with people, like just even checking them in at the front desk. I was very concerned about what was going on with them and wished that I could do more than just register them and get them ready to see the doctor. So I started working with a couple of the nurses that were there, and they kind of took me under their wing and taught me a lot of things and got me very interested in healthcare. So I first became a CNA and started rooming patients with them and learned a lot. Worked with Dr. Royer, who is still a doctor in our organization. He taught me a lot. And I decided I wanted to go further and become a nurse. So I enrolled at SMCC in Portland and did my LPN there, and was supposed to go out, work for a year, and then go back and get my RN, but that was 25 years ago. So I had kids and many other reasons why I didn't end up going back to school. But so my career advanced basically through working with people who encouraged me and inspired me. So as I've gone through and worked with this organization now for 16 years, that's what I try to do. I try to inspire people. I'm a supervisor now, so I have an awesome team. And I believe in leading from behind, so I try to lead by example, I guess, and promote the best customer service and patient care that I possibly can. I'm not hands-on anymore. I've worked in a hospital, I worked on med-surg, and I've worked rooming patients for most of my career, and I really loved that and enjoyed that because I just love people. But things changed and opportunities came up, and now my role is more teaching other people how to take care of people and making sure that down the line, the people that my team touch or that other people touch is the highest level of quality care.
It's a long story, a lot of reasons really. My mother was a certified geriatric nurse's assistant when I was growing up as a kid, and being that I was a young girl, a teenager, and in high school I actually started becoming interested in the field of nursing also, and became a CNA, and then worked alongside of my mother at the local nursing home. And I was always very proud of my mother. My mother was a lovely lady, very committed to her nursing and the patients that she served, and was a very compassionate woman, and gave her patients just all that she had. She was admired by all of the nursing staff and her patients, and she just was awesome. And so she was my initial inspiration. And as I say, I took the nursing classes in the local high school and then became a certified nurse's assistant. And then later in years, I became an RN, and that's how I began. And my mother, as I say, was my initial inspiration for starting my nursing.
Well, it's kind of interesting. I worked in as a life coach. I've been a certified life coach since 2006. And my son actually had a couple of incidents where we had to bring him to the hospital. And it just kind of got me thinking. There were things in that process that I felt like, oh, I wish we had this, or I wish I had known this. Things I would have done differently, or maybe asked different questions, maybe knowing more. So when this position was posted, I thought, oh my gosh, this is a great opportunity for me to, from the patient experience end of things, kind of help providers do a better job of connecting with patients. So that's what brought me in, and I just love it. We have so many wonderful, wonderful providers here. I feel really blessed to be here.
There've probably been a few defining moments that have helped me end up here. I'm not one of those people who, you know, when they were 5 years old said, hey, I want to go into healthcare. But when I was 13 years old, I was diagnosed with ovarian cancer. And so that really helped me grow up at a very young age. And so I have always found it very easy to understand how patients might feel, the loneliness as you travel through a sickness. But then I did a degree in business, and so I came to the United States to work for a company who made equipment for kids with special needs. And so that was my first exposure into healthcare. And then when I moved to Maine, I started working in our Heart and Vascular Institute. And by doing that, I started to work on a program called Saving Lives, where even with a business degree, we were able to identify patients who were overdue for care using our electronic medical record and reach out to them who were overdue for screenings. And that very first day, I remember sending out those letters to patients, and the phone started calling, and one of the gentlemen that we've done a story on, Raymond Barabee, 66-year-old man from Sabatis, came in to, he was screened for abdominal aortic aneurysm, and he came into the vascular lab where I was working, and the tech put the probe on and she found an 8-centimeter aneurysm. And that story and my involvement in that really helped to direct what I wanted to do in healthcare. So here's this person, a non-clinical person with a business background, who's now the Vice President of Quality and Patient Experience for the system. And so that moment is why I'm involved in quality and patient experience. Every day, even though it's a stressful environment, as it is for everybody who works in it, I really feel a responsibility that I'm a member of this community whose family comes here to have care. And every day I still feel I can make a difference in improving that. So that's why I'm here.
I had always wanted to be a nurse and a midwife. Don't really know what the true inspiration for that was, but I just kind of got hooked on it, and I spent the last 30 years of my life working in the healthcare industry in some format. I love helping people. I love making sure patients get taken care of, and there's never a dull moment. The joy that you get from seeing, from helping a patient feel better, or even for helping a patient, die with dignity or delivering a newborn baby. So many joys and personal pleasure for myself. And so it's not one thing, it's a collection of things.
Well, I've always been kind of attracted to helping people and making a difference. So I'm actually a business student. My major is finance and healthcare administration. So I think that as a business student, I'm very attracted to finding problems and finding solutions. And I think that especially in healthcare, there's a lot of opportunity for that, where it's constantly changing and there's constantly, new technology and new times with everything that comes with healthcare. So I guess that's what drew me to it.
I think I made the decision to become a physician when I was about 7 years old. And that was in part because I had such a family history of medicine. I had a grandfather two parents and lots of aunts and uncles who were all physicians. Although they were all trained and got their medical degrees in Ireland, my parents emigrated first to Canada and then to the United States. So I'm the oldest of four, and at about age 7 I thought, this looks like a great job. My parents are very happy, very engaged, and so for a long time that's just sort of what I knew I was going to do. But when you reach adolescence, you start questioning everything, and I certainly did, and I took a look at the expense and the time and the effort, and I said, gee, that's a lot of years after high school. It's very expensive here in the United States compared to Europe, and did I really want to work that hard? So I am glad I had those years of questioning, but in the end it turned out when I was about 21 or 22, I realized that really was what I wanted to do. So I had to jump through a few extra hoops, but I got a scholarship from the US Navy and they put me through medical school, and the rest is history. I did 9 years with the US Navy, trained in cardiology, and I was really very, very happy with my medical career. It was everything that I thought it was going to be, except instead of 11 extra years of training, it was actually 13. And it was expensive, but I got a scholarship. And the thing about medical training and medical education is you learn by doing, so you are in fact taking care of people relatively early. And it's so fulfilling and so fun, and the peer group is so challenging, and it's a dynamic job. The challenges are ever-changing. When I started my residency in New York City at Bellevue Hospital, it was the height of the AIDS epidemic, and at that time we didn't even know what this disease was. So many things have changed, and I've been really very appreciative of the privilege and opportunity to become a physician. The other piece of it that's kind of an end note is that after more than 25 years as a practicing cardiologist, I chose to go back to school and took a year off and got a master's in public health, and am now the chief of population health at Central Maine Healthcare. So I've stopped seeing patients, but all of those experiences over all of those years now inform me during a period of historic change in medicine. And I am really glad that I've had all of those years of training in the military and out of the military, and all of that patient experience to help physicians cope and hospital systems cope with some of the big challenges that we're now facing with all the changes. So it's really worked out well for me, and I'm really happy that I made the choices that I made.